Good afternoon, everyone. It is 2:30. Welcome to CCDPH's weekly COVID and schools update. I'm going to ask that everyone make sure that their line is muted. I hear some people that are unmuted. We want to make sure we have minimal distractions as we have a full agenda. Haven't seen you all since the beginning of the summer. Welcome. It's good to see you all. Before we begin with our updates, I just want to make everyone aware of a slight agenda change. Due to IDPH coming out with their testing protocol, we asked Beth Heller from IDPH to join us at 3 o'clock to discuss their testing protocol. That way everyone can be aware of what it takes to run a testing program with their school, and they can get any questions that they may have answered. So if you have the time, I know we normally end at 3, but if you have the time, please make sure that you stick around and come on for our call at 3 o'clock. So as usual, our objective is to support our area schools while navigating COVID-19 and answer any frequently asked questions that you may have, provide the latest contact information and resources for our schools. I have a few announcements. There have been some people who have reached out to various staff asking about webinar recordings. We are recording all of our webinars. Our CCDPH website is being updated. And once that's completed, all of our webinar recordings will be added to the website. So they're in the process of doing that now, and that will be completed shortly. So all of the webinars will be there for you to look at as your leisure and use for development for your staff if necessary. So here is just the latest contact information. If anyone needs it, it's our general CCDPH COVID email, which is ccdph.covid19@cookcountyhhs.org. Email for communicable disease reporting, and that's any communicable disease, not just COVID-19. You may have to report a vaccine preventable disease or any other diseases. So that will be ccdph_schools@cookcountyhhs.org. Our general Cook County Health Department website is cookcountypublichealth.org. Our school specific page is /school-health. Information on the COVID-19 vaccine has its own website at vaccine.cookcountyil.gov. And then also there are tools that anyone can use to communicate. There's a vaccine communication tools website at cookcountypublichealth.org /CCDPH COVID-19-communities. There's a lot of good information and some toolkits on there that you may be able to download that information in order to assist you in your efforts. And if you are not already aware, all of our mass vaccination sites are closed. If anyone participates in our EpiPen prescription request program or would like to, Keith Wynn used to be the coordinator for that program, and I am now the coordinator. So if you have a request for EpiPen prescriptions for your school, please email me, Kelly Jones, at kjones1@cookcountyhhs.org. Our doctor will furnish you with a prescription and a standing order. It will be up to the school to fill that prescription using the manners at which they have set forth by the administration. But if you don't know how to fill it, I can give you some resources that I have available for filling that prescription. So in addition to us closing our mass vaccination sites, Cook County has now zeroed in on the villages that are listed here who have the lowest vaccination rate. So we're zeroing in on these villages using hyper-local strategies. So we're trying to target them personally using different events. So if you are a part of this village or community, or you would like to assist in outreach into them, you can please contact us at ccdph.covid19@cookcountyhh.org if you'd like to host an educational or vaccine event or have ideas about how we can reach the community further in these areas. Cook County also has a school health advisory council, which usually meets to plan different events for Cook County, including our school health annual conference, which we all know we did not host in 2020 due to the pandemic, but we did turn it into a virtual event. We are not certain if we will be hosting an in-person event for 2022, but we want to begin to have those conversations and start planning in the event that we are able to. So the School Health Conference Advisory Council that assists CCDPH in keeping abreast of community needs, We help to plan the conference and other events. They advise CCDPH on the course of action regarding school communication and any needs. We are looking for more members. We are looking for a diverse membership of teachers, therapists, counselors. I may have forgotten someone, nurses, anyone who would like to participate from a wide variety of public, private schools and all throughout the area, north, south, and west. Please contact me, Kelly Jones, K Jones 1 at cookcountyhhs.org. We would like to get those meetings up and running and started soon so we can make those plans. If your school has an existing COVID-19 testing program, we'd love to hear more about it. I will drop the link for this survey into the chat. We'd like to know more about what you have planned, what you are doing, and how we can assist in that process. Also, Cook County Health Department, in partnership with Cook County President's Office, are sponsoring a survey called the Roadmap to Recovery. It's a rescue plan. In this way, the community can click this link, take a survey, and let us know what they think needs to be done in their area, in their community, things that Cook County should be making a priority for those communities. So if you'd like to participate in this survey, the link will be in the chat, and the link will also be on this slide. Cook County Health Department also participates in the CCDPH BINEX Rapid Antigen Testing Program. Using the link below, you can request rapid antigen tests for your school or for your agency or community center. And you can just request them using this website. Any questions or concerns, please reach out and we can help you with that process. You must fill out and get approved to have a waiver in order to request those tests. If you're interested in having a professional speaker speak to your group or community event about COVID-related subjects, you can submit a request via the Speakers Bureau link below, which will also be added into the chat and sent along with the slides. If you or someone you know cannot leave their house to get a COVID vaccine and they would like someone to give them an in-person, in-home vaccination, or they also need a ride to a vaccination site, they can call this 833-308-1988 number, and we can assist with that. They must live in Cook County proper. For those people who still need their vaccinations, this is another example of those hyperlocal strategies. At Markham Courthouse on this coming Monday and Tuesday from 9 to 3, there's a free vaccination event. Walk-ins only. Minors must be accompanied by their parent or guardian. As you know, is 12 and up are able to get their vaccine. Please accompany those children that age. And the second doses will be given out on August 31st. So please spread the word. If you know someone in your area or in your school who still has not gotten their vaccine and they need to go to a place to get their vaccine. So this is just information on how we can do on-site school vaccination clinics and resources and links to that. That'll also be in the slides. I appreciate you for standing by and listening to all of these updates that we have. We've been pretty busy and there's more things coming down the pike. Remember, for those who join later, that Beth Heller from IDPH will be getting on at 3 o'clock to discuss the IDPH testing program. I am going to stop sharing and toss it to Lex. And as you all know that the chat is disabled so we can listen to Lex's presentation. When we get to Q&A, I will release the chat and you can ask any questions you may have after that. Thanks a lot.
So here's the communicable diseases portion of the webinar. This is what we're going to address today. Have a reminder about Beth, general reminders, how to request immunization records, where we're at with our metrics, updated travel guidance, addressing all the mitigation strategies we should have in place, including the new masking legal requirement. Also how to set up testing infrastructure in your school, busing policy, lunch policy, band policy, sports policy, and some of the submitted questions that we got. If you don't see one of the questions you submitted listed under submitted questions, it's because we believed it was covered in a previous section of this, but if you think it wasn't fully addressed, just pop it in the chat during Q&A. All right. So just a reminder about the CCDPH schools email. That is who you should be emailing for all things COVID for schools, and then also other infectious diseases. And then as a reminder, just give us as much information about the situation as you possibly can. Names, date of birth, things like that. And then this slide is for reference. You've seen it before. This is just how to request immunization records for staff and students if you need an electronic record or want it to come directly from iCare. And then, as usual, got a guide to how to report school cases and close contacts for your reference, and getting to the stuff that's actually changed. So here is a metric update for Suburban Cook. So we are in substantial community transmission. We are not trending super well. If you remember last week, we were below 50, and this week we are at 70 and rising weekly cases per 100,000 residents. But on the bright side, nearly 50% of our total population has completed their vaccine series, which is pretty great considering that doesn't include anybody under the age of 12 yet. So that's really exciting. But I just wanted to include this graph here from IDPH that shows where our current trends are going. I added that red arrow and line just so you can kind of gauge, like, we're kind of where we were at the beginning of last school year in September. In fact, we're actually a little ahead of where we were in terms of the number of cases, in a bad way, than we were last year in the the actual age groups that are attending school. Also, updated travel guidance. We are following Chicago's guidance once again. So just know they added a couple of states to their no-go list for vaccinated travelers. They have to monitor their health, as we all should be doing, for 14 days. Recommended that they do a short quarantine and get tested, but that's not required. For unvaccinated travelers, as a reminder, we are following Chicago's guidance, not CDC. So quarantine until they receive a negative test result up to 10 days, or get a negative test results prior to arrival within a certain period of time. And then for international travelers, they have to have a negative test result prior to travel to the US, and that includes vaccinated people. And then they have to get tested after they arrive and then self-monitor symptoms. Hopefully you don't have too many students and staff in these situations that would push back their start date, but just so you know, this really should be stuck to. And then this is the warning from the recent FAQ from IDPH. If you go against public health guidance and best practices, you may have an issue with your insurers. So if you are planning to not do a mitigation measure for some reason, make sure you check with your insurers that if you have to pause school or close a couple classrooms because of an outbreak, that it will be covered. And then now that we have an actual mandate for universal masking in schools, I just wanted to let you guys know what the consequences are of not enforcing that or having a mask optional situation. So ISB has this authority now to enforce the mask mandate, and they can impose penalties on schools that do make masks optional, and that includes revoking recognition of the school. So any violations that are reported to CCDPH, those will be forwarded to ISB, just so you know. There are very real consequences besides just actually risking people's health, which is bad enough in itself. So let's get into what we can actually do to keep people safe. Obviously, follow these layered mitigation strategies. Vaccination, best protection we have, very safe. And then let me just address masking. So it's for everybody aged 2 years and older. They're required by law to wear a mask in the indoor school setting, regardless of their vaccination status. If there is a crowded outdoor setting or sustained close contact outdoors, masks should also be worn universally regardless of vaccination status. Obviously, there are exceptions for people who are unable to wear a mask for medical reason, and they should get medical documentation just so that's on file. In the classroom setting, if consistent and correct mask use is occurring universally, the close contact definition is within 3 feet, and that's for 15 minutes cumulatively over 24 hours. If masks are worn inconsistently or incorrectly in the classroom setting, the close contact definition is 6 feet. And then for everywhere that is not a classroom, so that includes, and I'll go on and address this a little bit, so that includes like the hallways or the band room, things like that, that close contact definition is 6 feet, and everybody should still be masks in those scenarios. And then just when this gets distributed, if you didn't feel like Googling it yourself, this is the actual executive order if you wanted to read it. And then I have the most important mitigation strategies that are, very doable in bold. So next is physical distancing. Close contact definition is what I said, and that 3 feet is only applicable in classroom settings. So it's not applicable in music rooms, in auditoriums, gymnasiums, any kind of like, my old high school had like a commons center, computer labs, spaces like that. Um, so that's 6 feet of distance in those scenarios. And that is specifically indoors. Outdoors, students can remove masks, have a good mask break. They can have very brief contact during recess or PE, but like sports contact or contact games like freeze tag should still be avoided. So just keep that in mind. Especially take advantage of the nice weather while we have it for a few more months. And then, as always, for now, avoid assemblies or large meetings. If you have to have them outdoors and spaced out. And then we're really hoping to push this for the next bit before school starts. The next most important thing, screening, testing, and reporting. So schools are really, really encouraged to implement screening and testing programs for all of their unvaccinated students and staff, or at the very least, high-risk sport and activity participants. At the bare minimum, it would be really, really helpful for schools to consider at least having a testing program in place for an outbreak situation, because it would help you recover days much faster if we can get through test results for people who may or may not have been exposed, and determine, who can stay in school. And then, of course, ventilations, make sure you're cracking windows while the weather's still nice. Think about whether you want to blast your AC a little bit more or earlier to accommodate kind of that hot feeling that comes from wearing masks, so that people are encouraged to wear their masks correctly. Ensure ventilation systems are operating prior to the start of the workday and after while activities are going on. And then, of course, hand hygiene and respiratory hygiene, coughing into your elbow. We're preventing other diseases too. We saw other diseases like common colds and norovirus, stomach flu were way down last year, and it would be amazing if we could keep that up this year too. Obviously, stay home when you're feeling sick. Even if it's something that could be a cold or a sinus infection, you just don't know in this situation right now. So stay home when you're sick, and encourage others to do so. Obviously, contact tracing, isolation, quarantine are important as always. And then I put cleaning and disinfection for shared materials on this slide with links to EPA and CDC guidance for your reference. I know we don't really have the funds in probably any school to have really individualized equipment all the time, especially lab equipment and things like that. So do your very best to disinfect equipment, but surface transmission isn't as likely as airborne or if someone slips up with mask use or things like that. So clean as much as possible, but don't be too frantic about it if you're worried, the cleaning solution is going to harm some of the equipment. Okay, setting up testing infrastructure in your school. I'm covering like very high level, broad overview because Beth Heller from Shield will be on to address more of this. But in case you didn't know, these tests are provided for free for all the schools in Illinois. And the ones that are being provided for free are Binax and Shield. So Binax is a rapid antigen test and Shield is a saliva PCR test. In order to perform these tests in schools, you need to get a CLIA certificate or waiver. If you're going to go with Shield, they can help you walk through that process. But otherwise, if you don't have a waiver yet, that link is up there. And there's also a pretty useful IDPH FAQ to help you walk through filling out that form as well. Once you have that waiver, you can request tests from us with the link that's provided, and IDPH. And then you will also need permission forms from parents. And I think Beth has some examples of forms that have been used, but I just quick Googled COVID testing permission forms, and you can see what other schools have out there as well, because that's on their school pages. And then you can think about having an opt-in strategy where parents sign the form and they're like, yes, I would like my child to be involved in this. or an opt-out strategy, which I personally would recommend. Usually it gets more people involved, and that is where parents say, actually, I don't want my child to be involved in this. So think about which strategy you think is most appropriate, discuss it with your legal team, of course. And then highly pushing Shield. They have several options for you guys to best suit your school for sample collection, for transportation, for testing, the actual testing. And then, of course, Beth will address that. And kind of your testing options you have are having a screening program in place that will be one time a week for unvaccinated students or staff, or specifically just for people who participate in high-risk activities. You might want to be set up for just outbreak situation testing, or maybe you'd like a test to stay program, which is a quarantine alternative that I'll explain in a minute. And then in lower transmission levels, our hope is that we can start using rapid antigen tests like Binax to help kids return to class if they just have a sore throat or something. But because we have a high transmission level right now, we're in substantial, we're not going to be able to do that right now. So there's been a little bit of confusion between like just having a testing program, having a screening program, or having a surveillance program. So I just wanted to go into definitions for a second. A screening program is where you test students and staff a certain number of times per week from week to week on a regular basis. Screening testing isn't just having some tests on hands in the health office, like you ordered like 100 Binax tests or something like that. So a screening test is really, really specific. And the goal of it is to catch people who are asymptomatic or pre-symptomatic before they actually get sick, pull them out of settings where they might otherwise be transmitting the virus. And then a screening program is also going to give schools more flexibility for quarantine options. Students and staff who have regularly scheduled tests for quarantine options will have those tests on file if you have to look back and say like, oh, on day 1 I tested negative, so I was not infectious on that day. So that's why a screening program is so useful. Now, so there were a lot of questions submitted about test to stay, and that's going to be addressed right now. So there are a lot of quarantine options for individuals who have had known close contact to a case. So option 1 is the usual individual quarantines for 14 days, and that's if they're not vaccinated. Option 2, if this person doesn't have any symptoms by day 10 and they're not vaccinated, that person can return to school on day 11, and that's a shortened quarantine option. Option 3 is if they have a negative PCR test taken on day 6 or after, and that can reduce their quarantine to 7 days. And this is actually now available to both students and staff if you look at the ISB FAQ. And then the option 4 is test to stay. So what test to stay is when you have a close contact, instead of having them quarantine at home for the duration of their quarantine period, it's actually a way to keep them in school or continue to work. And that is an okay option and a safe option as long as they're being tested on day 1, day 3, day 5, and day 7 with an authorized test. And if the results are negative at each test and that person doesn't have any symptoms, they can continue to attend school or work. So that means less days off, less trying to do makeup work, less asking teachers to put together bundles to send home to that student. And then just some caveats. If the testing isn't possible on the specified days 1, 3, 5, and 7, do it as soon as possible. We know weekends come up, we know holidays pop up, or institute days, for instance. And then also CCDPH does need to be notified of an individual who is participating in this test to stay program. And as I said, the individual has to remain asymptomatic at all times. If symptoms develop, isolation has to occur immediately. That may mean they have to be sent home from school if they develop a sore throat or a headache or a cough in the middle of the day. And in order to have this option, correct and consistent mask use has to be occurring at all times. That's not just you have to be following the mandate, that is students have to generally be wearing their masks correctly. And both the person who is a confirmed COVID case and that close contact have to be masked up in order to use this option. And then additionally, schools need to have that screening program I just discussed in place for this to be an option too. And the reason that goes so well together is because then they'll probably have a test on record for day 1 or day 3 early on in this process. This option is not available to household contacts, unfortunately, because close contact is going to continue to happen. So I hope that clears some things up on test to stay. Feel free to ask any questions in the chat later, and I bet Beth Heller can address some good ones too, because Shield is going to be helping administer test to stay programs with their screening programs. And then just as a reminder, here is the antigen test algorithm. Right now, because we're in substantial transmission, I just wanted to give you guys an example. So if a student comes to the nurse's office with a sore throat and you administer a Binax test, if it's positive, obviously they're going to be a case, but if it's negative, they need to get a confirmatory test before coming back, even if they don't have any known exposure. So at this point in time, if you're using Binax in the nurse's office, you need a confirmatory test for a negative, as a reminder. And then for busing, you've seen this, busing requires that everybody be wearing masks, regardless of what's going on in the school. So obviously that means the passengers and the drivers, but then also because everyone's masked up, there's no capacity limit. So you can bus everybody who needs to be bused to school. Just do your best to open windows and encourage people to take other forms of transportation if that is something the family can do. For lunches, got a few questions about lunches this week. We know 6 feet isn't possible for everybody in every situation, but maximize that physical distancing during eating. While it's nice outside, encourage outdoor eating, eating in multiple locations. Maybe you give up a gymnasium for the year, staggering lunch schedules. If possible, and I know this is hard for conversation, don't have students facing each other, like if you got like a little square table. But if it can't be maintained, just make sure you know where people are sitting by keeping a seating chart. In case someone does turn up positive, you need to know for contact tracing purposes who they were sitting with at lunch, who they might have exposed, especially because at lunch, people are talking more loudly, it's crowded, so there's a higher chance of aerosols going a little bit farther than they might otherwise. And of course, hand washing before and hand washing after lunch, which is just generally a good idea. And then band, I just want to give all of this guidance with a caveat that IDPH is working on updated music guidance. It hasn't been approved yet, but it is going to be coming out soon. Students need to be seated at least 6 feet apart and should not be facing each other. This is for band, this is for choir, this is for orchestra. If practice can go outside, have it go outside and at least have the windows open when the weather is permittable for that. All people who are playing instruments or singing or shouting or dancing need to be wearing masks at all times, and that's not face shields. These masks can have slits cut in them for the mouthpiece, but they can only be removed when you're outdoors and physically distanced. And for trombones, and also in the guidance was vuvuzelas, if you've got someone in the band playing that, that distance actually needs to be a little bit farther just because how far trombones can spread those aerosols. And then for wind instruments, a cloth covering needs to be added over the bell, whether that's a brass instrument and that cloth covering goes forward, or a wind instrument and the cloth covering goes at the bottom. Keep those in mind. I think that's the same guidance as last year, so that shouldn't be too new. Minimize shared instruments and other objects when possible. I know sometimes it's not possible, but make sure then those instruments are being really thoroughly cleaned between uses. When possible, limit rehearsal times to around 30 minutes if it's inside. And then this was a question from last week that I said I'd look into. Right now, the guidance is that a room should be aired out for one air exchange prior to the use of the room for the next music lesson or band rehearsal. So this may mean some instruction occurs maybe in a different classroom, like they do a little bit of music theory, or this may mean students just get a little bit longer amount of time to get their instruments ready before rehearsal. If you don't know what the air exchange rate is, your building engineering staff will probably know. I don't know if this is going to be in the IDPH guidance or not, but that's kind of how the room should be aired out between uses, since I know if you've got a band or music program, there's probably going to be like at least a couple periods where people are playing music at different levels. And then this is for high risk sports. You have seen this. I'm going to pass over just because I want to make sure we get on for Beth. And then address the submitted questions. So, first question: will students who have opted out of screening testing programs be allowed to use the 3-foot close contact definition? And the answer is yes. The close contact definition is based on mask use, not testing program use. So that is a-okay. And then, will siblings be able to remain at school if a household member tests positive in screening testing? And the answer is yes, kind of. If the sibling is vaccinated, they can remain at school as long as they don't develop symptoms. But if they're not vaccinated, the sibling can stay until the confirmatory test result is positive. So that test should be done within 48 hours. So they don't have to be sent home from school if their sibling is also sent home from school. If a child comes into the health office with a sore throat, can we do Binax now or Shield to determine if they can go back to class? So at this time, just because of our transmission level, like I mentioned before, a rapid test can't be used to return that student to class. If a student comes in with a potential COVID symptom, they need to be sent home and they need to be evaluated by a healthcare professional for an alternative diagnosis or receive a negative PCR test and have their symptoms resolve. You can see the decision tree for more details. Is there going to be a new decision tree? The answer is yes, it's coming. They're waiting for approval. So hang tight for that. And then, can Binax be used for the Test to Stay program? The answer is yes, it can. And then finally, are band members allowed to use face shields or do they need to be masked? Face shields are only permitted if someone has a medical reason to be using one. Otherwise, those players need to be masked. So hopefully that answers your questions. I will take a look in the chat while Beth is talking. But otherwise, thank you guys so much for your time. And I'm going to stop sharing and pass it off.
I want to thank you, Lex, for your presentation, and I see that Beth has joined us. I'd like to introduce Ms. Beth Heller from IDPH to talk about our SHIELD program. Thank you, Beth. You can go ahead and share your screen if you need to.
All right, great. Well, thank you so much. First of all, my name is Beth Heller, and I'm actually with SHIELD Illinois. I am the Senior Director of External Relations for the SHIELD University of Illinois program, but I'm really happy to share that John Arenas is here with us today, and he is from IDPH. So we can work tag team together on your questions. If you have anything related to SHIELD, I'm happy to answer. And if it's anything guidance related, I know John would be happy. John, do you want to say hi?
My name is John. I've been working on COVID testing with IDPH for almost a year now. I'm originally with community sites, but K through 12 has been my focus since about May. So happy to answer questions on guidance or just testing operations.
I'm going to go through this pretty quickly because I think many of you have seen our presentation, and I know we just listened to the health department's presentation on Test to Stay. So I think we can kind of skip some of our slides, and I think questions are probably, like John said, the most important. So just quickly as a recap, SHIELD Illinois is a screening and diagnostic program. Really helpful information was just shared about what a screening program is. But we are a PCR saliva-based test that was developed at the University of Illinois, and SHIELD Illinois was created as a nonprofit unit to really help work with all of the schools here on this call and the rest of the state to help provide this free additional mitigation layer to the process of getting your kids back to school. It was invented at the University of Illinois and rolled out throughout the state. We partnered with John and his team at IDPH to offer this testing to be free for every school in our state. And what we do is it takes a proactive approach to identify asymptomatic and pre-symptomatic carriers so that we can stop the chain of infection and have them quarantine. Results come quickly. They come within 24 hours of samples reaching the lab. We're HIPAA compliant. We report to IDPH, who in turn reports to the local health department, and all the results are delivered to the school district as well as the individuals. Our accuracy is very high. I've been with SHIELD since September and have not seen a false positive come through, and we have very low false negative rates as well. All of our labs are CLIA certified, meaning we handle the CLIA certification and the doctor's order for you, so your district doesn't have to do it. And it is an easy to collect method because it's saliva. We will also provide for free a third-party operations partner, and they can handle the collections and transportation to the lab. It is FDA, EUA approved, authorized, and you don't need a second test to confirm the result with our test. I'm just going through here quickly. John, we can come back, I think, if we need to on these guidance points. Here are where our labs are. We are adding a few more as more interest comes on. We've had about 140 school districts sign up in the last couple of weeks. So SHIELD is working very hard to get everybody up and running as quickly as possible. And this is just a very quick sample of some of the school districts we are working with. And like I said, I recognize a lot of names on this call. So our test, the reason why our test is so accurate is, of course, we are a PCR, which is the gold standard of testing. And we are looking at 3 different genes of the virus. So for us to have a positive labeled, labeled a positive, 2 of the 3 genes have to pop. And this helps us with false positives. And it also helps us so we can screen for variants of concern, as some of them have gene dropouts. So testing 3 genes really helps us. I'll share this slide because it always helps me understand why we're looking at screening testing for schools. You can see this red line right here is showing the shedding of the virus and the individual's viral load. So if you're infected on this point right here, the incubation period is about 5 days, and symptoms about 50% of the time onset at that 5th day after the incubation period. Here you can see this red line is showing the shedding of the virus and your viral load, meaning a day-ish before symptoms onset. If they do, you are at your viral load peak, and you are doing the most shedding. The SHIELD PCR test can come in here on days 1, 2, 3, if you're doing frequent testing or you catch them on the right day and catch it before the virus is transmissible. So this is why it's been so successful and with all of our partners, and of course, all the University of Illinois systems. And saliva is a great tool to use to measure, to check for the infection, because we can see it 1 or 2 days before the infectious phase. And a collection site example here, I'm going to skip the video that I normally show, which I'm happy to put in the chat, but basically an individual would check in, receive their vial, drool, and then check out. It's a very quick process. It takes under 10 minutes for individuals to leave their school classroom and go to the gym and come back. It takes me about 90 seconds to do the whole drooling operation. And after that, all the samples are taken to the lab and we deliver results within 24 hours. So the responsibilities for testing, IDPH and SHIELD will provide the funding, so it's free. We'll provide the technology, which is point and click. We provide all the supplies for the test, and we provide a third-party operations partner. Or if your school is doing self-collections, we provide funding at $8 per test to help cover costs. So the school district really is responsible for space, the operations plan, consent, communications, contact tracing, of course, working with your health department, and if you are doing self-collections, running that process. And so schools basically pick how they want to do it. Third party comes in, self-collections, or a combination of the 2. With test to stay, we're seeing a lot of hybrid models where the third party will come in and they will do weekly screening testing, and then the school district will handle the test to stay either with Binax or with SHIELD testing. We've recently worked out with the state to help school districts with Binax as well. So we will be able to provide training, the CLIA waiver, the physician's order, and reporting. The school would still be responsible for collections and obtaining supplies either from their health department or from IDPH. And then this is just a quick look at what our dashboard looks like. It's called Point and Click. And you can see it would be broken up by school district down to individual school location, by individual's name and their result. And it's a very easy system to manage. So if you're interested in doing testing with SHIELD, I will put in the chat a link to sign up. And it's not sign up, it's more of an interest form. And it will basically connect you with someone on our team, and we will be able to answer more of your questions that we don't get here today. So that is my very quick presentation. John, do you want to answer questions? Do you want to share anything?
Beth, if we could just go back to, I think it's slide 24, for folks to be taking a look at. I think that's a great summary. happy, and also just maybe addressing a couple questions that came up that are on this page. So I want to make really clear for folks that if you were thinking about Binax now but didn't go through with it and you don't have your CLIA, the goal is that Shield's CLIA is going to provide your regulatory infrastructure to do Binax now. So you sign up for Shield with weekly testing, and they'll be able to offer you that ability. So then you request from IDPH as you previously would have, but you have all your regulatory infrastructure in place. If you already have, Binax now on your own, you can continue to request, and you can still, do Shield weekly screening. I also want to clarify that the weekly screening is Shield, so that's the PCR test. You can do regular screening with an antigen test, but really when we talk about weekly screening through this Shield program, that's a PCR test. I can go through the list of questions if that's helpful for folks. I think there is one really more for CCDPH. People were asking, is test to stay an option while we're in substantial transmission? The IDPH guidelines at this time do not tie test to stay to the level of transmission, but if CCDPH feels that there's an additional requirement that they have, please go ahead and share with the group.
Hey John, this is Lex. So we talked about it last week, and we talked about it internally and with IDPH, and we decided that test to stay is an okay program for us to be using here during substantial transmission. So we are good to go on test to stay, folks.
Awesome, thanks for clarifying. And then someone else asked about the setup cost with Shield. Beth, do you want to talk about that?
Sure, and I'm sorry I went through all that so quickly, but I really just wanted to make sure you guys all had time for questions. There is no cost to the school district for testing at all. We provide all the tests. We provide the collections partner. If you are doing your own self-collection, you may need to handle your own transportation. And again, we would pay you $8 per test for each test. And so hopefully that would cover your transportation cost.
Great. Also want to just address, came up, about vaccinated folks. There's some nuances with vaccinated folks, and it's a changing picture for sure as we get more information about the Delta variant. But for now, we are not recommending or really even allowing vaccinated folks to participate in weekly screening. That's not recommended by the CDC. However, if a vaccinated person has symptoms, they should be tested and can be tested through the Shield program. And then if a vaccinated person has been exposed, the latest CDC guidance as of last week is it has gone from you don't have to take action to you recommended that you administer a PCR test between days 3 and 5. There is no quarantine mandate with that, but again, it's a recommended mitigation step because that person was exposed. Also, again, it sounds like CCDPH has their own Binax allocation through IDPH. You can make a request from IDPH. You can make a request through CCDPH. I put the information for that in the chat. But either one works for us. You're still kind of using those Binax through Shield and reporting that on the other end of the picture. So whichever you want to request through is just fine. Also for private schools, this is maybe new information to some folks. We've recently been able to open it up to all private schools in the state. That's thanks to federal funding through the extended testing program. That actually Shield happens to have won the bid for that grant. So they will be administering it as well. So if you are a private school and interested in Shield, you should definitely get in touch with Beth. The only difference for that is that we're not able to provide the cost of collection. So there's not the third-party collection team with that. You'd need to find a way to self-collect on site, and maybe ESSER funds would be a good opportunity there.
And I just wanted to share, I just put that interest form in the chat. So if you are interested, private school or public school, in having another meeting outside of here with your team, we are more than happy to set that up.
I also want to talk a little bit about outbreak testing. Someone asked, our current vendor can only get there, with 3 days after we find out we have an outbreak. We are highly, highly recommending to all school districts that they at least sign up for Shield and get ready for outbreak testing. Some districts don't feel like they can do weekly screening. We're talking to Cook County right now, so I'm pretty optimistic that most of you are in a political environment that will allow weekly screening at your school. So you want to do that, absolutely. That's the bedrock of a strong testing program. But if for whatever reason you're not able to do that, outbreak testing really is the bare minimum. And what that means is you go ahead and get in the infrastructure, get your students consented, rostered, and set up to do testing so that if an outbreak occurs, Shield can be there the next day, as soon as we know that there's an outbreak. But if you do not go ahead and sign up and you're trying to sign up in, say, September, October, when you have an outbreak on site, we could be delayed getting there by, as up to a week because the students might not be consented and you're not already part of the program. So it's very important that if you want that outbreak protection, that you go ahead and sign up for Shield now.
And I'll add to that we are at about 3 to 6 weeks for onboarding new school districts due to the high demand from many districts throughout the state. So if it is something you're considering, I do recommend you let us know as quickly as possible so we can get you started in the program.
Beth, do you want to talk about when someone tests positive through Shield?
Sure. If there's a positive case, it gets reported through our point and click system. And the school district is alerted with a push notification saying there's a positive in your health records portal. Please go check. And that school district and the third-party collections partner, if you are using one, would call the case, call the family or the individual and let them know they are positive. If the school chooses to have individuals alerted, we can set it up so that a link goes out to the family or to the individual with that result. And then daily, we report to IDPH, which in turn reports to CCDPH.
If I could just hop in here real quick, I wanted to address a question. Someone was asking about test to stay and screening programs for sports, and I'm not sure we have an answer for that yet. So if you can bear with us until next week, we'll send a message over to IDPH and ask if, you're exposed by an opposing team from a different school in an outdoor sport and you're not masked, if they're still eligible to test to stay. My initial instinct is no, but I just want to confirm. So bear with me till next week.
Hey, Lex, if you don't mind, I think, so when we talk about outdoor exposures, I think the latest IDPH guidance is pretty broad, that outdoor exposures are not going to be assessed regardless of masking. If CCDPH has its own policy on that, that is your prerogative as a local health department, but that the IDPH policy is outdoor is not going to be assessed.
So just to clarify, John, if there's an outdoor exposure through a sport, that effectively for IDPH guidance, that means that does not apply to test to stay. So they would still be eligible if they're in a test to stay program in their school.
Yeah, so they wouldn't need to do test to stay because they wouldn't be assessed as a close contact, would not be required to quarantine really in any way. So think about, if you are a close contact, you have to quarantine. If you have the right conditions, you can test to stay as an alternative to quarantine. IDPH won't be asking anyone exposed outdoors to even quarantine, according to the latest guidance. Now, part of the logic here is that when we're talking about, say, an opposing team playing football against one another, it's outdoors, the risk of spread against opposing teams is low, but we know that the team, one team is going to be spending time on a bus in carpools after the game, in practice together. So those contacts would be assessed based on the indoor basis. But when we know that people were only, outdoors, that's not the case. So I guess someone just said in the chat, outdoor sports, you're getting together on the bus. So again, if you were assessed indoors for part of that, well, that's an indoor exposure. So you're assessed on that basis. But if you're only outdoors with someone, that won't be assessed by IDPH.
Thanks so much for that clarification, John. And just to reiterate something that has been said in the chat, but I want to say it out loud so that everybody catches it. 7-day quarantine is available to students at this time. That is available to both staff and students. It used to only be available to adult staff members, but that is also available to students, to be clear.
And I love seeing kind of your recommendation about doing lunch outside. Lunch has been one of the hardest things for us to work through. I'm sure at the district level, it's just really difficult. The mask has to come off. But yeah, by bringing folks outside, that substantially reduces the risk of transmission and makes lunch, a lot easier. Obviously, we're in Illinois. That's not going to be the strategy all year, but at least getting us started here when we know Delta is really strong.
All right, I have one more question I wanted to address out loud because I've gotten this a few times. If CCDPH doesn't allow a single Binax test to be used to return someone to class during high community transmission, how is it okay for antigen tests to be used in the test to stay program? And I just wanted to let you know that this has to do with a little bit of a complex issue called pretest probability and how that is impacted by repetitive testing and how that ultimately impacts the accuracy of a diagnosis after a series of tests. So what I'm going to do is put this link in the chat that I think is pretty helpful at explaining some of these concepts. It's from the American Society of Microbiology, so it's not from our organization, but if you want a couple of good graphics, I feel like they have a pretty good explanation in that article. So hopefully that clears things up as to why it's okay to use in one situation, but not another. I also see a question on suctioning, and yes, if you can have an individual room for suctioning and air it out in between that occurring, that is best practice. But we said for summer camps, if you were on for those calls, when that's not possible, just space everybody out as much as possible. I think there might be some disability related guidance in the new FAQs, but I can get back to you on if there's anything specific to suctioning, but for now, follow what we've said about suctioning for summer camps and in other settings. You guys can keep the, oh, sorry, go ahead, Kelly.
No, I was just going to ask if there are any more questions. The chat got really quiet.
Looks like we have one more question. We can only be at 3 feet distance in classrooms. What if students are in cohorts? Would the hallway media center be an extension of the classroom if the students don't mix outside of their classmates? So I think what you're asking in essence is, in the non-classroom settings, if you're cohorted, do they still have to be 6 feet away in those other settings? I believe the answer to this is that if you're cohorting, it is okay if there is absolutely no mixing between the cohorts to be 3 feet apart in like your computer lab or things like that. I will double check and give you a definitive answer next week, but that is a really great question. So thank you for that. And then I'm not sure I said this in my presentation, but it's come up in my partner's classroom. So if you are in a situation where like maybe you have non-traditional seating, like everybody's at a lab table or things like that, and so you can't really say, oh, these desk edges are 3 feet apart or 6 feet apart, be measuring from like the edge of a body to the edge of a body. So like shoulder to shoulder, not center to center, because, you know, everyone's going to be wiggling in their seats a little bit or moving around as class goes on. So if you needed some clarification on that. It looks like we have a question for Beth, and you addressed it a little bit. Oh, yep, there we go. Actually, John already addressed it. Never mind. Thank you guys so much for that.
Sure. I think it's worth sharing with the group, though. If you're thinking that you might be interested, I'd recommend filling out Beth's interest form today, right now, as soon as you can. If you're not already interested, we have had so many folks get interested here in the last few weeks, and we have a bit of a backlog because of all the folks. So I just want to clarify also that the latest question, it's totally okay to use a Shield PCR test on a vaccinated individual, but it's not recommended, particularly because it's a limited resource and vaccinated people are relatively safe, right? Again, we are saying you can use that if someone has an exposure. It's not if someone has an exposure or has symptoms, absolutely feel free to use a Shield PCR test. It's not about the quality of the test or anything like that. The reason we're not recommending, and the CDC doesn't recommend any vaccinated individuals get tested, is because we're trying to prioritize resources for those unvaccinated individuals.
Oh, I think I can't remember if we addressed this or not. There was some confusion. We are following the Chicago guidance. So if you're confused about the discrepancy between the unvaccinated traveler guidance between different organizations, we are following Chicago's guidance right now. Hope that clarifies for you guys.
And I see a question in here about how soon will you contact us once we fill out the form. We've switched over to sort of an automated process. So once you fill out the form, you'll be assigned either to come to one of our Zoom presentations, which is, a more normal speed version of what I gave you in 3 minutes, or you'll be assigned, or you'll be asked if you want to attend a one-on-one meeting. And so it basically is just you picking a time that works based on all of our schedules of one of us that you'll meet with. So we are trying to get you in as quickly as possible. Will vaccinated individuals be turned away from third-party collection? No, we are just asking school districts to help us, urge people that are vaccinated not to participate in the weekly screening program and make it a policy from your school district. We recommend that individuals still sign up for consent, because if they have symptoms, or as John mentioned, if they're exposed, we're recommending they get tested on day 3, 4, or 5 after exposure, then they'll already be in the system and they can go through that process. So again, we're really looking for the school district support and guidance to their constituents. And yes, vaccinated individuals can absolutely get tested if they are exposed or have symptoms, and that's the recommendation.
Kristen asked, if school is eating at less than 6 feet and there's a positive case, are students still allowed to participate in test to stay? No. So when whoever was exposed when masks were off would not be allowed to participate in test to stay. Now, if you then turn back the clock and say, well, we know this kid was positive, but in third period, everyone was there and had their masks on, all of those kids would be able to participate in test to stay. But again, whoever was sitting next to them during lunch within those 6 feet would not be able to participate in test to stay. So it's not perfect. We're trying to reduce the amount of quarantines that happen, as much as possible while remaining safe. But once the mask comes off, it's not a super safe environment. Anyone that was exposed during that time would have to quarantine. But again, we do hope to offer test to stay for those students that were in the classroom. Carrie wants to know, Beth, can you clarify, is it certain that Binax now is covered through the Shield CLIA waiver, or are you still working on that?
It's certain, but we are getting it going. And really, if you sign up now for testing, we should be able to roll out both the Shield PCR test and Binax by the time you're up and running. So it is all locked in, and we have partnered with the state to help you with that.
Kathy asked, what's the quarantine guidance for bus exposure? The quarantine guidance is 6 feet based on indoor exposure. Lex, are you familiar with, specific bus guidelines? There may be something coming out, soon, or maybe there's something I've missed, particularly on buses. But I do know that buses are, everywhere now is requiring 100% masking.
Yeah, 100% masking is supposed to be happening, but obviously anybody who's still within that 6-foot radius would still be considered a close contact if they are unvaccinated, even if they were masked up. If anything else comes out, we'll let you guys know, but that's the current guidance for buses.
Someone asked about pharmacies offering free testing. So there's a federal partnership with pharmacies. You can take a look at the dph.illinois.gov/testing website, and there's a list of what we called it free federal partnership. That's a pharmacy that you can go to where it's guaranteed to be free. And those are all online. Some states are utilizing direct partnerships with pharmacies. That's been used on a federal level. That's going to require more work for both, I think, the parent and the district, but that's something you want to explore, to send kids to your local pharmacy if they need a test and they're not in school, or you want it, however you want to work that out. That's absolutely an option, and those pharmacies will provide free testing. So take a look at our website, drop in your, I'll drop in the link, and just throw in your zip code is the best way to use the map. And you can look at what's nearby the school. It's going to be a Walgreens or CVS. That's a free federal partnership, and you can send students there. And of course, if we have a community-based site in your area, that's also a great option. Beth, can you add the link to the chat? I think folks want the interest form.
Kelly, if you want to take us out, I'll make note of any questions that come in after, and we'll address them next week.
Sure. I want to thank Beth Heller with Shield. I'm sorry for misspeaking. And John Arenas from IDPH for taking the time out of their busy schedules to clear up everything with Shield testing. If anyone has any questions or concerns, we'll make sure we send them your way to answer the questions. We appreciate you being here. If there are no questions or concerns directed towards Lex, we will remind everyone that we will be here again next Friday. All of the slides will be sent out, and our webinar is being recorded. It will be uploaded to our Cook County Health Department website shortly. If there are no other questions or concerns, we will see you all next Friday. We appreciate you taking the time out of your schedule to be with us. Thank you, Lex and Palak. Thank you, Beth and John. Everyone be well and enjoy your weekend. Thank you. Have a great day.